First of all, I'm glad to be here. My name is Phil Waigand, and I'm age 65, been married 39 years, and I was diagnosed in 2009 with rectal stage 2 cancer. I had bleeding and they said, okay, colonoscopy is needed, so I went in and I thought, they said, usually it's not cancer, but we'll just have to do a colonoscopy to be sure to rule that out. So then I knew I had to wait for the diagnosis or get the lab report back from the doctor, which was a week, which was a very, very long week, waiting to know and thinking it was cancer. And then I got the news it was cancer. We knew about his background. We knew he was highly skilled. But I must say, at the time of meeting him, I was still thinking about money, getting a colostomy bag, how are we going to get through this? So your mind really doesn't click on all the levels because you're still preoccupied with, is this going to reoccur? I can't do it with the bag, and what's going to happen?
Phil stood out from many patients because his level of anxiety was such that he could hardly stand still in the room. My focus was just to make him feel comfortable. I wanted to make sure that he knew that I understood where he was. I think a good physician has to be a master at understanding where the patient is. There's no set rule. Some individuals, the more they know, the better. Some individuals, the more they know, the more anxiety.
I researched every word, everything about rectal cancer, the outcomes, and it was very beneficial to have the resources to look from different opinions, different websites, and there was a continual theme about how they usually treat this type of cancer. So I could compare notes and say, they usually do pre-chemo radiation, and the surgery is usually not optional but necessary, and then they might do afterward, the chemo which I had, but it prepared me. And it was reassuring that I could just click in on the internet and just see what other people, I go into people's blogs and see what they had done and what they suggested, and it gave you that you're not alone in this journey, that others have gone here and had much worse than I had.
Somebody that understands the disease and the process and is typically somebody that has certain goals and expectations. So in that sense, the more they know and the more they understand the disease, and then we sort of plug them into the realistic set of expectations, then their level of satisfaction is much greater, because they're not expecting to be able to run a marathon after the surgery. They know that it's going to take so many months to be able to run a marathon. And once they reach that level of understanding, based on all the knowledge that they have, they will be patient and satisfied with the progress until they reach a point where they are almost back to normal.
Well, you have to get a complete physical, which I haven't had in a long time, which they have to check everything out. So that, you're concerned that your general health okay, and that went very smoothly, and they did that very efficiently. This is the final step before you may have a procedure that'll change your life. And to know that if you say no, or you say stop it right now, then they'll buy you a little bit extra time, but you can't buy the time, you have to face it. But just that seed of doubt that you wanted to get out of the whole situation, it just sort of brought it to the surface saying, you decided, this is your decision.
It's a life-changing situation. To go into surgery hoping to come out normal with no bag in your side, and then finding yourself with a bag on your side is distressing. It's not the end of the world. Patients adapt very well. They can carry on their life, of course with some challenges and issues, but fortunately in his particular case, even though the likelihood of a colostomy was very high, we were able to preserve function.
This daily grind of dealing with finances and then you know, and then the treatment was a little hard at the end with the chemo. And when you combine the two on a daily basis, it drains you. You can't undo the past, and you can't make it different. You just stay today as it is.